Welcome to the deep dive. We pull apart the sources you've shared with us, the articles, the research, the forecasts, and we try to distill them into something you can use right away. And today, our mission is, I'd say, laser focused, especially if you're in your 40s, maybe your 50s. We're diving deep into that intersection of, well, health preservation and your financial future. I mean, the sources we looked at, they're all saying the same thing. Protecting your health is probably the single best financial strategy you have right now.
It really is. And to get started, we have to define why so many health economists were calling middle age. Roughly 45 to 65.
Yeah.
High stakes period.
High stakes.
Yeah. Where two incredibly powerful forces just collide. You've got the natural biological clock starting to wind down, and at the same time, your financial vulnerability starts to spike.
Okay, so it's not just about getting older.
Not at all. The real problem is the depletion of what we call your physiological reserve. You just aren't as robust as you were at 30. And without that buffer, the risk of one single health event completely derailing your life savings, it just skyrockets.
Okay, let's unpack that. Physiological reserve, that's a technical term, but it feels like the key to this whole conversation. What does that diminished reserve actually feel like for someone listening?
Right. Think of it this way. Physiological reserve is the gap between how you function on a normal day and, well, total failure. So at 30, if you catch a bad flu, you feel awful for a weekend, but you're probably back at work on Monday.
Right, a little tired maybe, but you bounce back.
You bounce back. Your reserve is huge. But at 55, that exact same flu, maybe you add in some chronic stress, you're not sleeping well, that can turn into pneumonia.
Oh, wow.
And that means a week in the hospital, maybe 3 weeks of missed work, intensive follow-up care. The body just doesn't have the extra capacity to fight things off anymore. And that lack of recovery, that is a huge financial liability.
That makes so much sense. The system is just running closer to the red line. And that vulnerability, that leads directly to what the researchers call medical impoverishment. It sounds severe, but what are the actual events that trigger it?
It is severe. The term is blunt for a reason. Medical impoverishment happens when the cost of saving your life is so high that it forces you to wipe out your entire financial cushion.
Everything you've saved.
Everything. We're talking about those catastrophic events. A sudden heart issue that needs bypass surgery, a complex cancer diagnosis that needs a year of specialized chemo, or a major injury, like a spinal injury that needs long-term rehab.
Yeah, and the sources were really clear that even with good insurance, you're still facing these massive bills. It's not just the copay.
Exactly. It's the specialty drugs that can cost thousands a month. It's a percentage of the surgeon's fees that aren't covered. And it's the huge out-of-pocket maximums that reset every single year. So if your recovery spans 2 years,
You pay it twice.
you pay it twice. And these aren't bills you pay by selling a few stocks. People end up liquidating their retirement funds, college savings, sometimes even the family home.
Yeah.
It is a crisis on two fronts.
That is the core risk. So, okay, let's shift to the real world pressures. Why does this happen? The sources kept pointing to the sandwich generation.
Yes, and this is a global thing. The research highlighted men from all over: William in the UK, Jack in Australia, Robert in the US, James in Canada. And what's amazing is that even with these totally different healthcare systems, the core pressure is identical.
Which is?
Time poverty.
Yeah.
They're stretched thin. They're managing care and often financial support for their elderly parents who are living longer but needing more help. And at the exact same time, they're supporting their own adult children who are struggling with housing costs or student loans.
They're squeezed from both sides.
Totally squeezed. And this balancing act, being there for your parents and being a safety net for your kids, it forces their own health down to priority number 5 or 6. It's not like they want to neglect themselves.
No, it's just resource exhaustion.
Precisely. And you see the clinical results of that exhaustion in the data. They ignore the persistent fatigue. They skip the annual physical that would have caught their rising blood pressure or, the slightly elevated blood sugar that's screaming pre-diabetes.
Because who has 2 hours for a doctor's visit when you're juggling all that?
Exactly. But by ignoring those early, cheap-to-manage warning signs, they're basically guaranteeing an acute health crisis down the line, a crisis that's exponentially more expensive to fix.
And I want to challenge that for a second. The sources say the threat is global, but how can the financial threat be the same for James in Canada with public health care and Robert in the U.S. with a high deductible plan?
That's a really crucial question. The threat isn't identical, no, but it is equally existential. For Robert in the U.S., the danger is obvious. It's the massive bill itself. The debt hits you like a truck.
Right.
For James in Canada or William in the UK, the threat is more subtle. It's often the wait times. Say William needs specialized orthopedic surgery. It's not urgent, so the wait could be, say, 18 months in the public system.
18 months?
18 months of chronic pain. That's 18 months where his work suffers. Maybe he has to stop working altogether. So eventually, he has to dip into his own savings to go private, just to save his ability to earn a living. The end result is the same. Savings are gone.
So the goal is always the same, no matter where you live.
Well,
Preserve your ability to work and avoid needing those high-cost, urgent procedures in the first place.
and this is where it gets really interesting. The research elevates health from just being a personal goal to being an economic imperative. Your health is the engine of your financial stability, period. If you're physically broken, that stability can just vanish.
Okay.
We need to look at the financial hit from two sides. The first is obvious, the direct costs, deductibles, copays, but also things people forget. Major home modifications, needing a stair lift, widened doorways for a wheelchair, renovating a bathroom. These are things insurance rarely covers, and they can cost tens of thousands of dollars out of pocket.
And the second point, which you said is often the biggest one, is the indirect loss of earning capacity.
That is the real killer. It's not just the 6 weeks you miss from work for the surgery. It's the 4 or 5 years after that where your energy is just gone, where chronic pain means you can't take that promotion or you have to cut back on clients. The income you lose over that decade can be way, way bigger than the actual medical bill itself.
So the solution being framed here is it's remarkably clear. Preventive medicine isn't just a doctor's recommendation. It is an explicit financial strategy.
It's a defensive one.
Right. You're making small, manageable investments now to avoid a catastrophic, life-altering expense later. So what does that investment actually look like? We can't just say eat better.
No, we have to get specific. The highest return activities are the ones that catch chronic disease before it shows symptoms. That means going beyond the basic physical. We're talking about annual A1C tests to catch prediabetes,
Okay.
high-sensitivity C-reactive protein tests to monitor inflammation, regular bone density scans, especially for women. Catching prediabetes early means you can manage it with diet and exercise, almost no cost. Catching it late means insulin, monitors, potential organ damage, a devastating financial drain.
So you're investing a bit of time and a few $100s today to protect potentially millions in earnings and assets over the next 20 years. That's a compelling financial case.
Absolutely, and it goes beyond blood work. It's about managing stress, which, as we said, can literally liquidate your savings through its physical damage.
And we can't underestimate that psychological burden. When someone realizes they have to sell their retirement nest egg to pay for rehab, the stress from that just pours fuel on the physical fire. It creates this awful feedback loop.
Which is why the whole approach has to be holistic,
Yeah.
body and mind together.
Okay, so let's get into the practical, evidence-based interventions. First up, the sources all say movement is medicine. But let's clarify. It's not just about jogging, is it?
No. While cardio is vital, what's financially paramount is strength training,
Why strength training specifically?
because it's the #1 defense against frailty. And frailty, that loss of muscle mass and bone density, is one of the most expensive conditions in later life because it leads to falls.
Oh.
A single hip fracture in a 60-year-old can trigger a complete financial catastrophe. Surgery, long-term nursing care, loss of independence. The costs are astronomical. 30 minutes of strength training twice a week is the cheapest and most effective insurance policy you can buy against that.
That completely reframes going to the gym. It's not about vanity, it's fall risk management.
Exactly. And that leads to things like medical massage or physical therapy. People dismiss them as luxuries, but the sources see them as essential maintenance.
Proactive maintenance, like changing the oil in your car.
Perfect analogy. You're managing chronic tension and correcting posture before it turns into a full-blown crisis that needs expensive steroid injections or surgery.
What I found fascinating was how critical the non-physical stuff is, like sleep hygiene and mental health. You can be running marathons, but if you're only sleeping 4 hours a night, you're still financially vulnerable.
Because sleep is when the body actually repairs the damage from all that stress. Chronic sleep deprivation just destroys your immune response and your cognitive function. It accelerates that whole physiological decline.
And if you're cognitively compromised from exhaustion, you're going to make bad financial decisions anyway.
You can make bad decisions everywhere.
Right.
Which is why supporting your mental health therapy, mindfulness, whatever works, is so critical. It helps you manage the baseline stress that makes you ignore the warning signs in the first place.
So when we pull this all together, What's the ultimate goal here? For us, for this conversation, it's about empowering you, the listener, to take agency over your own trajectory. We can't stop the calendar from turning, but we absolutely can influence the biological clock that really determines our financial future.
And if we connect that to the big picture, the sources are really suggesting a fundamental shift in personal finance. For someone in their 50s, the focus has to pivot away from just wealth accumulation, squeezing every last dollar into savings, and toward health preservation.
Because protecting the body's integrity is the most critical way to protect your financial integrity.
Without it, every single dollar you have accumulated is at risk of being wiped out.
So our final takeaway is maybe the most powerful one. You have to start viewing your body as the single most valuable asset you own. It's worth more than your house, more than your stock portfolio. And like any valuable asset, it requires constant, mindful, targeted investment, not just reactive fixes when something breaks, to yield the highest dividends of longevity, independence, and, peace of mind.
And that really leaves us with a final thought for you to consider. The research is clear. The transition into your senior years should be a time of reflection, of enjoyment, of mentorship.
It shouldn't be what it so often is today.
Exactly. It shouldn't be a desperate reactive battle against sickness and paralyzing debt. By taking this proactive, financially rational stance toward your health today, you can rewrite that narrative. You can ensure that the fruits of your life's work are preserved for your family, for your own enjoyment, instead of being consumed by preventable medical crisis. Invest wisely.